America is struggling to control the spread of the virus and rising death toll. Here in Nigeria, government and health officials have been warning residents to take appropriate safety precaution to avoid a second wave of the disease. Currently, the number of confirmed infections stands at 67,557, with a death toll of 1,173. Joining me to discuss Nigeria's battle to control the spread of COVID-19 is Pascal Achinine, the Executive Director, Health Emergency Initiative. Thank you very much for joining me.
Nice having me.
First of all, why does it seem like Africa as a whole, in Africa, there's been a lower prevalence of the novel coronavirus in sub-Saharan Africa, unlike other continents of the world, the US, Europe, and Asia?
Many have actually attributed it to the climatic condition.
Okay.
That the tropical climate does not create, as opposed to the temperate region in this, especially the likes of Europe and US, that it does not seem to support the spread of the virus. That has not been 100% scientifically proven.
Okay.
But it goes in contrast with the projection at the beginning that when this virus gets to Africa, everywhere the streets will be littered with corpses. So it's a mystery, some might as it were, but the little I can attribute it, and which is also the popular opinion, is that is traced to the climatic condition.
But it's not been scientifically proven.
Yes.
But does it also have to do with the fact that in Nigeria especially, we're used to going to the hospitals, taking all forms of medications and all of that?
Nigeria is already exposed to extensive pandemics, several pandemics. And some people use there's this popular saying that jam doesn't kill a black man, especially in Africa. But I think the measures that have been deployed by the government and other stakeholders, as commendable as it may be, one cannot safely say that that's the reason why the spread is very low.
Okay.
And as I speak, the situation in town is got so mind-boggling that most of the isolation centers have been closed down. Most of the testing centers owned by the government, most of them are not even receiving a lot, or some are not even receiving samples to test. As it were, the recent discoveries show that the private laboratories are more patronized, and those who actually patronize the private laboratories are those who are either traveling in or out of the country who need a certificate. Not because people are safety conscious to know their health status, such that there is an informal picture painted out there that people are being forced or coerced to go to those private labs because there are some understanding of some deals that happens because it's 50,000 plus, as the case may be. So the reality is that even some ad hoc staff in some of the testing centers owned by the government, so many of them are either not being paid or not. I mean, some of them are not being effectively engaged again because they feel that they're not getting enough enough samples to test. So it's a concern, but there's also a danger in it, because the international airspace is still open. A lot of Nigerians are traveling in and out. Business travels have commenced. People even travel on holidays as we speak. So in those climes where those destinations, UK, the rest of Europe, US, and others, they still have lockdown occasioned by second wave. The shocker is that people come into Nigeria. And I've had a number of interactions with some cases where somebody came into Nigeria, or people returned to Nigeria, that are required to run the test, that are required to self-isolate, but there is no enforcement. They don't do that. So it's not very comfortable, especially with Harmattan season likely to come.
Does this show how, as a nation, we are handling the COVID-19 pandemic?
True.
Especially with you've just mentioned the second wave as well.
Yes, because it is also very experienced that as a nation, we deploy an emergency response system that can address this in case a second wave comes. But even the second, how did the COVID-19 get to Nigeria? People traveled, and I mean, travelers that came to Nigeria, non-Nigerians and other Nigerians, that was how the infection began. And as we speak, there has been that original consciousness among regulators and stakeholders is being lowered. That if there's a second wave, we'll be caught off guard. And of course, the vaccine conversation around vaccine is not even featuring seriously in our table here. So yes, we know that there's been some mileage by Pfizer and Moderna, and that's
BioNTech as well.
Yeah. So, but when we even get here, assuming it happens. So we must, one key area the government, the gatekeepers, so to say, gatekeepers, whether at the airport, gatekeepers among the safety agencies and health officials, is those that return to Nigeria. How do you keep vigilance? How do you enforce to make sure that they self-isolate, all the protocols are observed?
Yeah. Okay, so talking about vaccine production now, like you mentioned, Pfizer, BioNTech, Moderna, there are companies that are at the forefront of this vaccine production all over the world, and Nigerians are often at a very professional table. You know, like recently, a doctor was amongst those was among those who invented the vaccine in Pfizer. But why couldn't Nigeria, as a nation, lead the chase for the production of COVID-19 vaccine?
Of course, we know we have research institutes. Also, we know we have the universities. Assuming the universities are running.
What is happening? Why are we waiting cap in hand for the modern world, the developed world, to do this and bring to us?
We must move away from being reactionary, because those societies where you have seen some mileage, they are proactive. They consider that man can conquer the world and deal with issues. You don't just throw your hands in the air. So our situation is leadership need to rise up to this, because we have the technical know-how, persons who have the endowment. If someone from Abia State or far away in the US can be among the inventors, it means that if we look locally, we'll find persons who have the skill set. And I've come across some academics. I know of someone in UI who say that they have developed some local treatment solutions. It's not been fully certified by NAFDAC and other regulatory agencies, but they have done some trials that seem to have worked.
And trials on patients?
Patients.
Okay.
So this is curative now. This is not just vaccine. So what it means is that if the capacity to develop that local solution to the point it has got to is further harnessed, we can also be in the league of nations that are coming up with vaccines that can not only serve Nigeria, but serve other parts of the world. But first of all, we must identify and place premium on the skill set of the people here. What I'm trying to say is we must value knowledge, we must value research, and we must deliberately and intentionally deploy resources to make sure it works, not something that is done ad hoc. Wherever you see, as a nation, whenever you see us taking a step, is most times ad hoc or reactionary. We don't just plan it intentionally that this is what we want to achieve, this is a strategy, this is how we're going to the action.
When should we have started planning for a vaccine?
From the day the virus first appeared in China, and there is we are in a global village. From that day, a unit in the whether it's the Federal Ministry of Health or any department as it were, whether state or federal level, that move should have started. Of course, we have some research institutions here that have a saddle with responsibility of making the discovery. So those things should have featured in the table, and resources allocated to it with some form of independent entity. Because one of the things I see in Nigeria that usually make things not to work is monitoring and evaluation is not integrated in our programs.
Okay.
So, and talking about monitoring and evaluation, so this is what you want to achieve. These are the steps you must take to ensure that at every phase or milestone, what the goal is being monitored, not just by those who are inside that organization, but some independent entity.
All right, so before we end this now, like we have been talking about developing vaccine, but you see Nigerians have also done well in different areas, very admirable ways. Now, first of all, the Nigerian Institute of Medical Research announced the development of a $25 40-minute test kit this year. That will help ramp up tests. Nigerian health investment firm Flying Doctors boosted testing by commencing use of mobile booths, testing booths. Despite these advances, there are no news of any local effort to develop a vaccine. So, looking at our research institutes now, what is the cause of the problem? Why are we not developing in a way that, like you have said, will become one of the vaccine development,
the go-to country,
the go-to countries? And what should the government do?
Okay, if you check the way resource allocation happens here, you will find out that most of those research institutes possibly make some progress in what they're doing because they get grants. But as a nation, yes, perhaps they get grants from external parties outside the country. But as a nation, research is not something you treat, you relate to, whether you have, whether you figure out you have the revenue decline or not, because most of the things that happen in our countries that will deal with the symptoms. So going back to the question you asked, as a country, whether it's the state, federal, or even private sector, there must be some coalition of efforts. And government, in order for people to trust government measures, because again, one of the challenges people have with anything government is trust. So government must enlist support of private and social sectors. Okay, this is what we want to achieve, and this is the research we want to undertake in this area. So you provide your own your support that would help in ensuring that what we want to do with the research sector or research institutes will achieve it. Most of those, I want to clarify that most research institutes in Nigeria have required manpower to achieve what is done abroad, but they need to be supported, and the political way to provide that support needs to come in.
All right, thank you very much. On this note, we'll end this discussion at this point. Thank you very much.